Hi, my name's Dr. Steve Z. I'm one of the emergency medicine physicians here at Enloe Medical Center, trying to give you a sense of what you'll experience when you come to the hospital as either a patient or a prospective visitor. Let's go over to the first tent where everybody will get checked out. So this is the tent where you're going to get your initial screening, and the nice people here are going to take your temperature and ask you some questions to see if you might have some symptoms that are related to COVID-19. You can see that everybody here is in their personal protective equipment. My bet that's the word of the year for Webster Dictionary.
Hi.
Hi.
This is where we come in to do our first assessment. So you'll come in. We have these lovely ladies here that will help out, but we check to make sure you don't have a cough, fever, shortness of breath, any kind of symptoms like that. At that point, we'll come in, take your temperature, and we'll see how you're doing. If you're doing okay, we'll send you to the direction you need to go. And if you have some symptoms, then we'll send you to another tent to be further evaluated.
Thanks.
You're welcome.
Guys, stay safe out here. Thanks for doing your work.
Thank you.
Okay, so I'm just going to give you a quick recap. You could be one of 4 different camps. You could be someone who came here as a visitor, and if you pass the screening without any issues, they'll direct you to where else in the hospital you should go. If you're actually a visitor who had some symptoms, they're going to say, we'd like you to please go home unless you feel sick enough that you need to be seen as a patient. If you came here as a patient, you'll either be directed into the emergency department if you pass the screening, or you'll be directed to come over here to the tent where you'll get some additional discussion with other medical professionals about what's going on for you today. Let's go on over to the tent here where you would land if you're a patient who had a positive screening. So here we are. This is our tent. And in here we have registration and nursing, and you'll also get a chance to see either a physician's assistant or a nurse practitioner. And they'll be able to work with you, talk to you, do an exam, and see whether or not you're well enough to go home, meaning you could have symptoms, but you don't actually need to come into the hospital, but you might want to go home and isolate, or whether you have symptoms and a situation that merits being seen by one of the doctors, and then you'd be directed to go into the hospital. So a quick recap. If at the first tent it's felt that you could have symptoms that are suspicious for COVID-19, you'll be directed over to the second tent. A nurse will evaluate there, a physician's assistant or a nurse practitioner will evaluate you there. They'll get a history and do an appropriate exam, and then you'll be told one of 2 things. Either you look well enough and seem well enough to go home, and maybe you ought to isolate because you have suspicious symptoms, or they'll say, no, you really need to see one of our doctors, and they'll direct you toward the emergency department. And all these measures that we're doing, they're really all about keeping our community safe and healthy. It's for the people in this town and this region so that their health is good, and it's also to protect us here at the hospital who are frontline medical providers. If our health is good and your health is good, then as a team, this area is the best off it can possibly be, and we'll get through this all together. So we're going to be checking in weekly with you. It could very well be that next week's a little different than this week. And the reason is that every single day we are carefully monitoring the situation, what's being recommended at the national level, what the local circumstances here are on the ground, and we're being flexible like we need to be because this thing is a moving target and we need to move along with it. Stay healthy, stay at home, be safe.